Hey guys, my name's Connie, and I am doing these YouTube videos. This is my first ever because I'm going to be having gastric bypass surgery in a little bit less than 3 weeks. And I wanted to do these videos primarily for myself as a way to express myself and a way to deal with some of the emotions that are going to come along with this surgery, and just also a record to look back on and see really how far I have come. Also, possibly some people might watch them and get some encouragement out of them and learn some things. I know when I first was looking into having the surgery, I did a lot of research, but then I also watched a lot of YouTube videos, and one of the people that I watched all of her videos in a span of a couple of weeks, which took a long time, but it was really good, was Faith KP. And the reason she was really good was she was just a real person. You know, she talked about stuff that you really are going to deal with, and you know, she was honest about it and up front about it too. Also, she had surgery with the same doctor I'm having surgery with, and I'm going to Mexico to have surgery. So, and that's kind of another story. My insurance wouldn't cover it, so that meant I had a private pay. And if you've ever looked into private pay gastric bypass surgery here in the United States, you're basically buying a new car. So, I'm going to Mexico to have my surgery done, and so that's why I'm starting to do these videos, and I'm excited. I'm a little, I don't know, it's really weird kind of talking to myself, although sometimes I really do talk to myself, but doing it in front of a video is a little bit different, and putting it out there for everybody to see is a little bit different too. So I kind of just wanted to tell you guys who I am and go from there. So, like I said, my name is Connie. I'm 26 years old. I'm married and have been married for about 5 years. Middle of June is our anniversary, so roughly 5 years. And fun, interesting fact about me is I was raised in Panama, Central America. My parents are missionaries still, but that's why we were there. We lived there for many years, and that's where I grew up. So that's kind of an interesting fact. I have been overweight most of my life. There was a couple years where I was thin. However, how I got to be that way was not a healthy way to do it, and I might talk about that in some other videos. But, so I've struggled with my weight my whole life, and I am ready to just deal with it and deal with it in a healthy way and be done with it. You know, I don't want to be one of those people who wait until their 50s or their 40s or even later to address their weight issue. You know, I'm young and I have a lot of life left in me, and I really want to enjoy it. You know, I want to be comfortable with how I look, you know, and I feel fine with who I am. I like who I am. I like my personality. You know, I like me. I like my life, but I'm very unhealthy. And I'm ready. You know, I'm ready to address this issue, this one area in my life that I just haven't been able to get control over. So, that's why I'm doing these. And, you know, it's going to be a long time, and I understand that, and that's why I want to do these videos, is because I realize that this isn't just a fad diet. You know, having the gastric bypass is not just something that's a cure-all, and I realize that, and I have done enough research and enough watching of other people's YouTube videos to realize that what the gastric bypass does is it forces you to eat healthy. It forces you to learn the appropriate portion sizes of foods, and it gives you that tool. And I'm ready for this tool. I need this tool. And I start my pre-op diet, and my doctor, all of the doctors do things differently. My doctor in Mexico wants me to do a 2-week pre-op diet, which consists of only liquids, clear liquids. So, you know, sugar-free drink mixes, broths, sugar-free jellos, popsicles that are sugar-free, that's basically it. So that I will start this coming Tuesday, which will be May 27th. And that will be the start of my 2-week diet. And out of all of this, out of all of, coming up to the surgery, this is the part that I really dread, the 2-week pre-op diet. Because I can promise you there has never been time that I haven't eaten food. So, it'll be interesting to see how it goes. And I'm planning on doing videos pretty frequently, and possibly every day of the 2-week pre-op diet, if not just for you guys, but also for me, just a way to talk through my feelings and how I'm doing with only liquids. And I also am going to be starting to go to Overeaters Anonymous class, and the local hospital here in our town has it on Monday night. So I'm going to go, I've got 2 Mondays before the surgery, so I'm going to go this upcoming Monday and then the next one, and, start dealing with my food issues. And that was something else I wanted to talk about too, is for me personally, I had to realize that my poor choices in food and my poor habits in food are my fault. There's nobody to blame. There's nobody to say, oh, well, you did this, that's why I'm this size, because it's nobody's fault. I did this to myself. I've made myself this unhealthy. And it's harder to admit that, I think, than to blame somebody else. And for me, I realized that I did this. I did this to myself. It was my bad choices throughout the past, I'm 26, so the past years that I've been old enough to make choices on my own to, in the area of food, they're my bad choices. It's not my parents, it's not how I was raised, and although our culture, many cultures, we use food to deal with things, when we are celebrating, we have food. And when we get together, typically we get together to eat. And when there's a funeral, there's food after a funeral. So I get it that our culture is very food driven. But again, nobody was sitting there force feeding me food. They weren't sitting there making me eat 2 brownies or 3 brownies or 5 cookies or pizza. Nobody was sitting there doing it. I did this to myself. And it's a little bit hard to admit that. It's hard to admit that I did this. There's nobody to blame but me. So I am looking forward to resolving some of these food issues that I've had for a long time. And I'm gonna be honest. I'm gonna let you know how things go, and I'm gonna let you know how I feel. And I'm planning on making videos while I am in Mexico. And hopefully I can show you guys where I went, in case, some of you guys have looked into it and your insurance won't cover the surgery. Maybe you'll feel comfortable after seeing where I go and my experience, and, we'll see how it goes. So I will get off of here, and I'm sure I'll talk with you all later. Bye.